Joining us now to talk about your health is Dr. Nidhi Kotwal, pediatric pulmonologist at the University of Maryland Children's Hospital and assistant professor at the University of Maryland School of Medicine. Doctor, thank you for joining us. You have important information for the parents of children heading back to school, particularly those with asthma. Tell us about that.
Absolutely. So asthma is, one of the most common chronic diseases of childhood, and we take extreme precaution in giving certain plans to patients who have asthma at the beginning of the school year. And the reason this is important is because you want to make sure that a child is able to attend, to have a good full attendance at school and not be limited because of asthma. And that, people who take care of the children at school also know the care plan and are able to take part in taking care of the child when it comes to an asthma exacerbation.
You mentioned it's a common concern. How common is it? Maybe in an elementary school of 500 kids, how many might have asthma?
So when we look at national statistics, if you take a school of a class of 30 children, 3 out of 30 will have asthma in a national average. And usually in Maryland, some data shows that Maryland asthma is a little higher than national average. So if you were to take like 8.7% for national average or 8.5, Maryland is a little higher, so 9.5. And Baltimore City in itself is a little higher than that too. So Maryland itself is a little bit higher on asthma prevalence. And then parts of Maryland are even higher in that sense. So this number, 3 out of 30, may be a lot more in Baltimore City as compared to another place in Maryland, to give you that variation.
Are there differences in severity?
Yes, absolutely. So asthma is graded from mild to severe persistent asthma. And so mild is when you have symptoms from time to time, not every day. And then moderate is when you have daily symptoms. And then severe is when you have all day, every day symptoms. And by symptoms, I mostly mean coughing or a dry cough or say wheezing or shortness of breath that comes from time to time. It's important to note that asthma is a very episodic disease. So there are certain triggers for it and may only show up with those triggers. So there are times that you're fine, but then there are times when you can have a full-blown asthma flare.
What are the most common triggers?
Yes, so there are certain triggers that are seasonal, and then certain triggers that are more year-round. So to give you some examples, like if I were to talk about just fall season, because we're approaching fall now, cold weather. So the change in weather from a hot and humid to a cold and dry weather can lead to asthma flares in many patients. That's one of the biggest triggers. Then viruses. So we all know that there's more circulation of flu, COVID, and RSV, other viruses like that in the fall and winter. So that's a huge trigger for children going back to school, and even others, everybody else. Additional triggers can be ragweed or pollen from late blooming plants. So we've seen that with global temperatures rising, that the ragweed is increasing, and we're seeing an increase in asthma symptoms for people who are allergic to ragweed. Other things that could be are strong smells are triggers, and then if you come to like year-round triggers, you're looking at dust mites, tobacco smoke, or smoke in general. Again, strong emotions could be a huge trigger. Even like pets, dogs, cats, dander, animal dander, even roaches, pests at home could be a trigger for some people, mice, those things. So pollution. So there are certain year-round triggers like that. So it just depends who's allergic to what or what are triggers of certain patients. So we do recommend seeing an allergist if you have seen certain trends like that. So if you've seen that, your child's asthma flares up in certain seasons like fall and spring, we suggest you see an allergist, get tested for it so that they can give you a pollen calendar and tell you what precautions to take before the start of that season.
So from the back to school standpoint, what would go into an asthma action plan for a child? Maybe think about different levels of severity and different ages.
Absolutely. So in an asthma action plan, so this is basically a written individualized action plan, like the word says, but it gives you a lot of information. It tells you, of course, the name, the date of birth of the child, and then gives you the severity of asthma on there. So the physician can check mark the severity so people know. And then there is 3 sections on the plan. There is a green zone, a yellow zone, and a red zone. It also has a section for triggers. So a physician can even write down what triggers the patient has particularly. And then on the green zone, you write down the daily medications that the child takes. The yellow zone is for when you are you're sick or you have a flare up or you're triggered by your asthma is getting triggered. Then that's the yellow zone, but you're not sick enough to go to the hospital. And then red zone is when none of those medications are working and you're still having cough, difficulty breathing. That's the time to call 911 or go to the nearest emergency room. So it tells you in stages what to do, and it's a very useful document to have on hand.
How can families work with the medical profession, also with schools? And I don't know how many schools still have licensed nurses on premises all the time, but what should family members know?
Absolutely. So family members, I think it's important to communicate about your child's asthma to all or most of the family members who take care of the child at any point. And I say that because, some children spend time in 2 homes, or some children will spend part of their time at their grandparents' home or something. And so everyone who takes care of the child should be aware of that plan. You could ask for extra copies from your physician, or you can just make copies and have it on a accessible area. So some people have it on their fridge, some people have it in the medicine cabinet. And it's important to communicate and say, hey, this is the everyday medication and this is the rescue medication. And it's important because it's difficult. Sometimes it's easy to mix it up, the medications up. So if the parent can explain the people taking care of the child, it's actually better for the child and it prevents asthma flares. We see better outcomes. Now, they can do the same with school by communicating with the school teacher. And then many times, most schools will have a licensed school nurse who will keep, or public schools that we are talking to, or patients that they all have school nurses who can keep asthma action plans at school, or even a form that has a medication administration form on it, and just the physician can write down the medication on it and then when to use it. It's just helpful to have that, just creates a more supportive environment for the child and minimizes risk.
And it's important from the child's perspective to do that, to minimize the risk and have everything ready, because it just has to be such a traumatic thing to have an asthma attack in any environment, school in particular.
No, absolutely. Yeah, that's true. Because I think what anyone needs, and especially a patient with asthma, is understanding of the disease, and for his friends in school and teachers to understand the child's limitation. But at the same time, that support is what helps them and encourages them to allow full participation in school. Right. And so I think that communication is helpful. Sometimes also I see nurses reaching out to physicians and parents saying, your child had an asthma attack. For example, the information we get from nurses is also very helpful, because it helps us to increase the controller medication if needed to help with asthma control. So it's basically a village that's taking care of the child with asthma, and it's input from anywhere is important for the physician and for the family.
What kind of limitations would a child with asthma have? I mean, if there's a recess period or athletics, I mean, you need to think about all those things.
Yes. So most of the limitations that can happen are more in the PE, physical education side. And that's when we see someone have an asthma flare right after recess or right after sports or PE session, which is why if that information is brought up to the treating physician prior to the school year, then that can be mentioned in the form or in the plan, or at any point, actually. If you see something, just say it to the doctor and they can make that change in the plan. There are ways to actually have medication administered before recess as well in order to prevent an attack. And that's something that can be added on your plan as well.
Has anything changed lately in the management of asthma in either children or adults? I mean, I'm thinking the rescue inhaler thing has been around for a long time, right?
Yes. So asthma, it's a good question because for the longest time we have albuterol, which is the rescue inhaler that is being given, and it's a bronchodilator. It relaxes the muscle of the airway. But now there's more research being done in combination inhalers being used as controlling and rescue. And it's just at this point, there's a few medications that are approved to be used by a lot of researchers out there. These are not FDA approved yet, so we're still waiting on full FDA approval for these kind of use of these medications as rescue. So currently, we're still using albuterol as rescuers in schools.
Possible to prevent someone from, if you know it runs in the family and does it run in the family, but if you have reason to suspect that a child may be prone to developing this, is there anything you could do to prevent it?
Yes. So their asthma has a huge genetic predisposition, like you brought up, but at the same time, there's also environmental factors that lead to certain flare-ups. So many families with parents who have asthma already start noticing signs early on in their children just because they themselves have experienced asthma before. So I think education by their own way helps them recognize these signs in their child. But is there a way to prevent? So preventing viral infections, younger kids who are born premature, giving them vaccination against common viral infections like RSV, influenza, even COVID vaccinations are shown to be safe and effective in patients who are prone to or have underlying lung conditions.
Very good. Dr. Nidhi Kotwal from the University of Maryland Children's Hospital. Doctor, we appreciate your time. Thank you very much.
Thank you for having me.